Hi, this is Dr. Lonnie, and tonight we have a wonderful interview with a woman named Sue Krug, who is part of a group called Soft Bones. And we're going to hear her story and also hear about uh, genetic defects that she's had to deal with in her lifetime as a result in terms of the phosphorus. And I'm also going to talk a bit about phosphorus because phosphorus is important for the strength of our bones. Too much of it's not good, and sometimes we can get too much of it if we're not eating a good diet or if it's really heavy in dairy and meat and some other things. And also some sodas that have phosphoric acid in it. You don't want to have that. But tonight we're going to focus more on if it's low and what can happen to bone. I got interested in this because of the bone group that I'm in, because there are people who have low phosphorus and it's not caught. And those people can have a lot of fractures and they're not being treated properly. They're not diagnosed properly. And it's called, again, hypophosphatemia. And as you'll learn from Sue, this is a genetic condition. And you can have, and don't worry, Sue, because you can repeat things a million times so people can, hear it more than once. Can have like one genetic defect, or you can, from one parent, or you can have it from both parents. And if you do have it from both parents, I think you probably shouldn't be alive. I'm going to ask Sue that because in her case, I think that's probably the case, that she is an outlier. You hear me talk about that a lot in terms of that she survived with having both defects. So actually, I think I'm going to bring you on right now, Sue. So go ahead and unmute yourself.
Hi, everyone.
Yeah, and welcome, Sue.
Thank you.
Happy to have you here. First of all, I would like you to talk about your own experience. I'm sure you've talked about it before, so you can help lead people into, your diagnosis and, talk a little bit about yourself and your history and your association with the Soft Bones group.
Oh, okay. Well, I'm the patient liaison for the Soft Bones group. My journey started at birth. I have 2 mutations, and they call it hypophosphatasia because of the low alkaline phosphatase that you have. I was born with 2 mutations, and I was born with some broken bones at that time. That's how they knew something was wrong. Otherwise, I looked perfect, according to my mother. And but as time went on, I had failure to thrive. And within the first 3 months, I was breaking femurs and having pneumonias and not eating well. So that was a clue. And back then, they believed that 50% of the people born with this would perish. And I had such low alkaline phosphatase at that time that they didn't think I would live past my first birthday.
And let me
obviously I did.
Add to that. Now, the alkaline phosphatase is a very simple test. Mm-hmm. That's part of a blood chemistry test. So we'll get into that. But it's a very simple test, and most doctors are overlooking it. But go ahead, Sue.
Right. So that was the big thing. How they figured it out back in 1960, I'm not quite sure, because it's a very rare mutation. My parents didn't know they carried the genes. And until I was born, they didn't know it was in the family tree. But looking back, we can connect the dots with like my grandmother getting early onset, what they called osteoporosis at that time, and other similarities. But for me, I ended up fracturing quite a bit. I had failure to thrive, but then it just turned into a lot of bone fractures. And as time went on, they invented what was called rodding surgery, putting a rod in the bone. And that got me up and out of a wheelchair and walking, and the pneumonias had stopped. Well, this has gone on. And since I lived, they changed my diagnosis. They said, oh, we must be wrong. Even though I still had low alkaline phosphatase, it was never higher than 15 all my life. They changed it to another rare bone disease and said, well, you could have juvenile osteoporosis or osteogenesis imperfecta. They didn't know. So that's the way I carried on until I was in my 50s and genetics finally came around, and I was tested, and sure enough, I have 2 mutations of hypophosphatasia.
Okay, so maybe we'll just go ahead and go
Mhm.
through your slides. And I want to say this. I hope I didn't say it incorrectly. I hope I didn't say hyperphosphatasia, because it is hypophosphatasia that we're
It's
talking about.
you said hypophosphatemia.
I did
which
say it.
is-
Okay, good.
But that is technically the scientific term for it also.
Yeah.
But it is hypophosphatasia, so that they can make the difference between a different rare disease called XLH.
Yeah. And, there are, in part of, I'm going to do a series actually on genetic conditions that can impact our bone. And those folks that I'm most concerned about are people who have osteoporosis, who've had multiple fractures, and they're not really getting answers. Bone, a diagnosis has to make sense to me. Someone has to be telling me if they have really serious osteoporosis, some story like, oh yeah, I had anorexia for 2 years. I wasn't eating. I have some sort of digestive disease, something really not good, or I'm looking for something. And this is one of those things that I have found, rarely, I have to say, but the doctors in my group find it because they're astute osteoporosis doctors, and they know that if somebody has one gene mutation, that these are the folks that can start, they have osteoporosis, but more later in life, they start developing more fractures. Is that correct?
That is correct. They can almost have the normal childhood, what they think is normal, maybe just more growing pains than they should. And, it's blown away. Oh, you got growing pains and stuff, and think they have a normal life. And then around late 30s to 40s, they start getting, hey, you got osteoporosis, or they step off a curb and their foot breaks. And that might be the only symptom that starts the doctors going, well, let's check your bones, and then they get diagnosed wrong. Yeah.
Yeah. I have that very case that you're talking about right now in my family, stepping off a curb. I mean, that just shouldn't happen. Not a real serious shattering kind of fracture. Okay. So let's, I'm going to go to your slides now. Okay. So we're going to go through about 4 to 6 slides, and then we're going to talk more. I might interrupt. Don't.
Please do.
Okay. Okay.
Okay. Well, hypophosphatasia is a rare inherited inborn error of metabolism that results in impaired bone mineralization. So it's basically the bones do not harden. We don't get the nice firm bones as you age. Bones are soft and they fracture easy. And one of the hallmarks things is that you heal slower. It takes longer to heal a fracture. The signs and symptoms greatly affect individuals in a range of severities, from mild to life-threatening in newborns. Some newborns, you can't even see their ribs or their chest bones, that have 2 mutations. So they usually have difficulty breathing. The disease is lifelong because it is genetic, and it does progress over time. But again, it doesn't progress at the same rate in every person, especially those with one mutation. If their one good alkaline phosphatase gene is normal and strong, you might not get symptoms till you're in your 50s of it. Depending on whether you receive 1 or 2 mutations from each parent has a bearing on how severe the symptoms become and problematic enough for diagnosis. Usually it takes a fracture or something if you're young, to bring it to the attention of doctors. And the hallmark test is as simple, that should be done yearly, is a comprehensive metabolic panel that includes the alkaline phosphatase. And you should look on there, and the results should be for sex and age, because it does vary. In a couple of years ago, labs were putting adult ranges on children's, and that just, hurts the diagnosis. And if you do have a low alkaline phosphatase, you should ask your doctors for a vitamin B6 test, because that will be elevated unless you're taking a mega dose of vitamin B6. It's pretty hard to get it out of range. So that's one of the easiest tests. For adults, of course, it's the soft bones that are prone to non-traumatic atypical femur fractures.
Oh, wait, can I just let me interrupt
Sure.
for 1 second? The phosphorus test.
That's sometimes normal in us. It's
But
not
I still order it.
right. I would
Yeah.
include that.
Yeah, and sometimes, so I don't know if you have this in your slides, but I do want to get into, someone can still have normal alkaline phosphatase, but what would be an alkaline phosphatase that's considered really normal? And okay, they don't have hypophosphatasia.
For adults, anybody over 18, I think in both male and female, it has to be above 40.
Okay, thank you.
Anything below that is questionable. And then you would run the inorganic phosphorus test, phosphatase test, and then the B6. And if either of those or both are elevated, then you need to go find a bone specialist and have more tests done.
Okay,
And
we'll go over
not-
the, yeah.
Yeah.
Okay, we'll go over the tests again at the end here.
The hallmark symptoms are fragile bones, and sometimes the fragile bones don't show up. I can give you an example. My sister has one mutation. She hasn't actually had a fracture yet. She played soccer, but she gets more of but she has osteoporosis, and she did have it in her 40s. Long bone deformities can, like knock-kneed or hip misalignments is one of the clues if you're having a lot of hip pain. Adults usually get chipping of the teeth and cracking that's not explainable by your dentist. And if he says, oh, at your dentist and you're having your checkup, your bone is absorbing, that's one of the signs dentists find in adult hypophosphatasia, and there might not be any other symptoms. High pseudofractures of the femur and feet reoccur without issues, and a pseudofracture isn't a complete fracture, but it looks like it's healing and it's not. Bone pain, poor muscle tone, and less stamina. When I say muscle tone in adults, it's like you can't keep going all day, go grocery shopping, come home, do the laundry and cook dinner. You're usually fatigued somewhere in there muscle wise. And the biggest complaint for adults with hypophosphatasia is the fibromyalgia type of bone pain, that they have aches and pains all over.
Okay, let me go back to the femur and reoccurring foot fractures. So you're also talking about what can be described as what do you call it? Fractures, stress fractures.
Yes.
But are you saying that these fractures, would it also be true? Because it's really interesting with osteoporosis cases, even people who are losing bone, often, even if they're losing bone, their bones are going to heal fine when they have a fracture. It's kind of like a separation in a way. So you're saying with folks with even a single mutation, that one of the hallmarks might be that they don't heal properly. Is that always the case, do you think?
Yes,
Or-
it is. In at least 80% of the cases, yes.
Well, okay, that 80%, but 20% maybe not. Maybe
not. Yeah, it's iffy, again, how good their one good mutation is. But majority of them, if you're supposed to heal any kind of fracture in 6 to 8 weeks, even one mutation in your super mild will take you about 12 weeks to get to the same place as the average population would be at 6 weeks. So it doubles the time.
Yeah, I have to tell you, the term soft bones bugs me, and here's why. Because orthopedists often, that's what they always say. When they're in there doing the surgery, and I've talked to a lot of them, when they're in there doing the surgery, they say, the person has soft bones. By the way, orthopedic surgeons are not trained in osteoporosis.
Yeah.
So if they have that actually means the person has osteoporosis. So soft bones can simply mean, from an orthopedic perspective, that when they cut through that bone, or they try to put a screw in that bone, it doesn't have purchase. And that's what that means. If they can't screw into the bone and it doesn't hold, that it's not gaining purchase. So the term soft bone, I think, can be a bit misleading. So, but it does correlate when you're talking about younger people and what can happen with the deformities, similarly to osteomalacia that can happen with vitamin D deficiency.
That is the medical term they use for the adults, is osteomalacia.
Yeah. Okay, good.
Which, you know, when we looked up, that's why how we got our name. Osteomalacia means soft bones. So, but I understand what you're saying, and that is correct.
Yeah, because as an adult, it's different. It's not the same.
Rickets in children and osteomalacia in adults.
So as an adult, does the bone still have that soft, more pliable situation, or does it become more brittle?
It's, well, okay. If you have two mutations, I can explain. My orthopedic explained it like this. My bone, he could push a toothpick with his fingers through my bone, my tibia. Okay. In adults with one mutation, it's like you have a hard shell, like an eggshell on the outside, but then it becomes soft inside, where the screw should anchor. Well, you know, it's mushier is what I want to say.
So it is mushier. It's not.
Yeah, it is mushier.
Okay. Well, we'll speak in terms people understand.
Yeah, that's what I'm trying to do. It is. Yeah. The compressed bone is soft, yet it doesn't, I can tell you, it doesn't have the hydroxyapatite crystals to harden it.
Okay. That's
exactly our bone problem.
Thank you.
Yeah.
Okay. So let's go. We'll entertain questions in a minute.
Okay. This kind of explains the bones. Number 3 is osteoporosis bones. You can see how it hollows out to number 2, which is the normal. And then ours, my disease is like this. We have bigger holes that the trabecula is okay in there, the scaffolding. We've got the scaffolding, but we don't have the soft stuff in between to hold it together. Wait a minute.
So number one is
hypophosphatasia.
Yeah, that's what I thought. Okay.
Yes, but you can see the holes are bigger. It's almost like we stay in a pediatric state.
Okay.
But if you have one mutation, you get more of the outside shell. So it looks a little bit like a thin layer. I'm pointing, like you know what I'm doing. On number 2, it's a little thicker around the edge than it looks like on number 1. That's more like my bone, 2 mutations.
It's kind of cute you're pointing, but they can't see.
Yeah, I know. It's kind of stupid. Sorry, people.
No, it's okay. It's okay.
Sometimes I talk with my hands.
Yeah, sometimes I touch my big screen expecting it to do something. Okay. So then I lost the question I was just going to ask. It'll come back to me. Okay, so what we're really talking about in a certain way is trabecular bone, because the compact bone is the hard shell. So does hypophosphatasia impact compact bone equally to the trabecular bone, or is it somewhat different?
They say the scaffolding is good because it doesn't affect our collagen. So I'm assuming when they mean scaffolding, that's the trabecular bone.
Yes, it is.
Yes. And that is hard for us. It's flexible, but it's all there, formed correctly. It's missing the crystals in between the compact bone and the trabecular bone that hardens, like those salt crystals of hydroxyapatite, to continue to grow, to give it firmness. We bend, and we kind of, our bones, instead of, like you were saying, shatter and break, ours more or less tear. That kind of bone quality we're talking about. But very few people, unless you have 2 mutations, will break all the way through and get a displacement. Usually it's hairline fractures and things like that just continue not to heal. They will heal like 60% and it just stops because the sender does not, it builds And if the bone isn't held together with a rod in there, holding it still, our bones just crumble again within 6 weeks and it opens up to fracture again. So
Wow.
that's why healing is longer. Okay. You know, it's very complicated.
Well, no, but we're breaking it down, and that's good.
And bone x-rays, the biggest thing, if you're in your 20s to 30, they can still see there's a translucent in the tongue part of your wrists right here in the radius, and the fibula at the very top will look like it's osteoporosis, and that's the sign of HPP also.
Okay, show the wrist part.
The wrist is the radius part. Oh, sorry. The radius part of your bone right here,
Yeah.
right when it's near the growing plate. It's actually translucent. I have x-rays. You can't see bone in there. It looks like it's not there. It's just a light gray. And the rest of the bone looks normal.
And what happens to the fibula?
And the fibula top looks like it's moth-eaten. It looks slightly chewed and it's really thin with mineralization on an x-ray.
Now you say the top is near the knee. But
Yeah, the distal, but right by the knee, where it connects to the fibula connects to the tibia, right there. It's
well, that's
kind of
proximal. Okay, so you're saying
proximal, sorry.
Okay, that's okay.
proximal.
Yeah, okay. So now would these bone abnormalities they wouldn't be seen in usually a single, or would it be seen in a single genetic
X-ray?
X-ray,
In
yeah.
a single, yes. My
Might see
sister actually, yeah. I'm using my sister as an example because she doesn't care if I talk about her. But yes, it's single, and my parents also. It's seen there.
Yeah.
Mhm. And that's why sometimes adults have no other symptoms but slightly knock-kneed look to them when they walk. And it's usually because the fibula, I know it's not a weight-bearing bone, but it does show wear in hypophosphatasia compared to the average population.
Well, it's interesting because, of course, we used to see even a lot more of the bow-legged people because of vitamin D deficiency, actually.
Yeah, that's vitamin D.
So does that happen too? The bowed leg, or
yes, it can. It can in severe cases, but
so
never.
The bones are soft and they just bend and then conform. Okay.
It doesn't really happen in the single mutations, though. They get, which is weird, they get knock-kneed because one leg will actually be shorter than the other, which is normal, but it's way shorter. So, for some reason, they do not know why one side with one single mutation, they're getting to know that one side of our body is shorter, which everybody's is, but this is majorly shorter.
Well, the issue is that there's never going to be, it's kind of to do a big study on that, you couldn't even find enough people. And so it's probably not going to happen, but it's something that's noticed.
Right.
Yeah. No, but this, and I just want to bring in now the understanding as everyone's listening to this, maybe they don't have your genetic issues, but understanding that importance of phosphorus. And that vitamin D, in fact, all these, for bones to be healthy, it's a lot of different factors. Vitamin D has to be good in terms of bringing, which I'm going to go into again a little bit later, to bring in enough phosphorus and calcium. And that is the second most common, highest amount, if you will, mineral in our bones is phosphorus. And you don't have that. And that's what makes bones strong. So that's what is keeping your bones on the weaker side.
But with our mutation, we can't take a supplement to force it in there either.
And why is that?
It's called because of inorganic pyrophosphate is so elevated that it inhibits mineralization in our bone.
Anyway, yeah. So it's not about, I'm glad you said that. This is not about just taking more phosphorus. You can't. And so it seems counterintuitive. That, okay, well, I'll just take more phosphorus. No, when you have these mutations, bone is highly complex, so when you're missing something, there's a whole range of things that aren't going to work properly to secure the scaffolding, to make sure it's supple. I mean, it's amazing to me that bones ever work or anything works when you think about it.
I am too.
Yeah.
But yes. And we went through the lab test. Definitely an ALP means alkaline phosphatase, and it should be done yearly on everybody anyway, in a comprehensive, just to make sure.
Now, wait
They
a minute.
are
Let
now
me
throwing in
wait.
thyroid. Sorry.
Wait a minute. Now, let me ask you that, because many genetic conditions, and I'll give you a good example. I have both genes for celiac disease. I don't have celiac, but it does affect me. So now I know that I have both genes. Do I want to do gluten? No. So in your case, you're saying, well, do the alkaline phosphatase every year. Are you saying that sometimes maybe that gene hasn't expressed itself?
Yes.
Okay, that's what we're talking about here. Okay, I really want everyone to get this, because sometimes genes are so aggressive, as in your case, you were breaking bones at birth. And then there's different gradations, maybe even of a double gene, I don't know. But like some people have multiple sclerosis early in life. Some get it later in life. All these things, the genetics are powerful. And I really resent, frankly, when I hear a lot of alternative doctors downplaying genetics, because a lot about osteoporosis is about genetics. And yes, we can curb some of the genetics by eating properly and doing all those things in terms of the effects. But sometimes genetics are freaking genetics. And we can do what we can do. And you've done an amazing job to be as healthy as you are. I know you had to work at it, given what you started with.
My mother was just told, don't give her any calcium. Take dairy completely out. And that's basically what saved my life. Instead of giving me formula, there was a lady down our block, and she happened to be from Europe, and she goes, oh, we call them glass babies. She came in.
Wow.
And she said, can the milk, don't give her any type of dairy, and boil up liver, put it in your blender, add the water to it and feed her. And little did you know that eating a meat-based liver type of formula has alkaline phosphatase, and that's what they think kept me alive. Plus keeping me away from the extra calcium in the diet saved my kidneys at a young age.
Wow. So
Because if for me, I can't absorb the calcium, it would go through my kidneys to eliminate that extra to make the heart work right, and therefore then get nephrocalcinosis and kidney failure. It was just a freaking accident.
yeah. To have this, they call glass babies. And so this woman somehow knew that. That's amazing.
Yeah, in Europe, she's like, oh yeah, because my mom would feed me. They tried all the formulas in 1960, even her breast milk. And she'd give me 4 ounces. I throw up 3. She said, I could walk you right to the kitchen sink and it would just come flying out of you. I'm like, that's my brother and my sister. They said, we learned how to duck at a very early age because you could projectile vomit it across the room.
Wow.
And it was the calcium. My body thought it was poison in there. And it
was for you.
It was for me.
Well,
now,
what about vitamin D? Okay, so what about vitamin D?
My mom put me in the sun because the windows were not treated,
okay, so wait a minute. So
I got vitamin D the natural way all through your year.
But what about taking vitamin D?
Taking vitamin D actually would make my joints swell up at that point, because it wasn't being absorbed with the calcium, and it was making more of a inflammatory response in the joints.
Although I wonder if you were getting D2 or D3.
The 60s, I don't know.
Oh, you probably were actually getting D3, because that's what they put in milk and that's what they put in other things.
In the 1960s, yeah.
Probably was D3. Well, that's interesting and requires more thinking on my part, because
right now I can only take D2. Only because D3 is made out of lanolin, and I happen to be allergic to lanolin oil.
No. D3, my most recent book is on D3. So
I better read it. Yeah.
I'll give it to you. Give me your address. So D3 can either come from fish product, or also there's a vegetarian form of D3 now, which is you can get it. It is from fungus. But it actually, when it gets into sunlight, some mushrooms will produce D2. but others can produce D3. So it's lichen. Lichen is what produces D3, which is very interesting. But I would be interested to know what the difference might be, because either one's going to increase calcium and phosphorus absorption.
Well, I can tell you, if you're not on treatment for HPP, even with one mutation, you can be taking 10,000 units. I know that's really high per week of vitamin D3, and it will only maybe get you up to 30. The rest of it, they do not know why it doesn't go into the body any more than that. We can't get up to normal.
Well, it's a
But
fat
once you
soluble
start the
vitamin.
once you start the treatment, your body, which is alkaline phosphatase, the treatment, you basically can absorb the vitamin D again.
Well, this may be a longer conversation. I may have ideas about this. I mean, 10,000 a week actually isn't a lot.
Oh, okay.
You know, 2,000 a day is usually what gets people in my sweet spot, which is 45 nanograms per milliliter. But I'd have to think through the physiology of this.
Mhm.
You know, maybe you and I can talk sometime about that. It's very curious.
Sure.
Yeah.
Mhm.
But yeah, through the sun, it's kind of interesting because when we make vitamin D through the sun, we make vitamin D, but actually some of it converts into actual vitamin D. We get a provitamin D, but some of it actually converts in the skin itself and in some of the organs. So now the vitamin D that we take in also goes to these organs, but there is a difference when we make it from the skin versus when we, take it in orally. It has to be somewhat different, and it is. Turns out to be
And
different.
in my case, it's slowed down fracturing in the summertime when my mom would make me be out for 30 minutes at least every day without sunscreen back then. Sorry, I'm a copper tone baby. But she would only make sure my legs when I was younger out in the sun,
Well,
exposure.
I have a whole slideshow I presented where early on they had kids in these solariums. They would put their foot out, to get, like it was like they even knew, right? And then they would put a leg or two out. And like somehow but thank God she put your legs out, not just your feet. But
well, they broke the most. So she thought, well, let's suck in the sun that way.
Yeah, well, but then you have to be out at the right time. You have to be out at the time where the UVB rays are producing, which is when the sun is at solar noon. So during the winter, depending on where you're living, you could be laying out in the sun all day and you're not going to make it.
Right.
Which is maybe why you were breaking bones in the winter and not in the summer.
Mm-hmm.
So
yeah, I had a windowsill to sit on in Chicago, and there's not much sun in Chicago.
Yeah, well, and if you're in a window, you don't make any vitamin D.
Oh,
So
well, they were the old windows, that had
no, it doesn't matter. Any kind of glass will completely block vitamin D production.
Well, then that's why. Then probably
you need my book. You need my book.
I need my book.
Yeah. So cats and dogs, actually cats and dogs get their vitamin D from licking their fur, but laying in the sun from a window doesn't give them vitamin D. And like sheep, or like you say, lanolin, like a lot of vitamin D does come from lanolin, it's in the sheep's wool. And that's how they get their vitamin D. But not now, because we rip off their wool and we take it. Okay. Okay.
Okay. Where did I leave off? So basically there is a gene test now, and it's on chromosome 1 on the short arm, and they can do the ALPL gene and see if you have a mutation. And it is surprising how many that never thought they had HPP because they didn't fracture. We've had marathoners, in high school and stuff. And it wasn't until they got in their 40s to the symptoms, 40s, 50s, 60s, that their symptoms started to show up. And they get the test, the gene, and they have it.
Okay, now I want to make sure that I don't forget this. You had said, and I forget the name of it because I've heard it before. I've heard Michael Leckie and others talk about it. The place that where they do the genetic testing that we think is doing a good job on genetic testing starts with an I.
Yeah, Invitae. I call it Invitae.
Spell it.
I-N. Excuse me, I have to write it down. INVITEA.
Yeah, because I'm going to actually see if I can get someone from the company to talk with us. Because the other issue is that there's a lot of home test kits or genetic testing that are utter BS. And there's a lot of that going on right now. So
Yeah,
I want to get to the bottom of that. And I'm also interested.
23andMe and stuff like that.
Yeah,
will
no. I
Not do
can't trust
anything
that.
for you.
Thank you for bringing that up, because that's an important thing, because people, I'll just, yeah, okay. So I think we're just, go ahead. I think
Yeah, we're just about done. The treatment, there is only one treatment. That so much has been tried, because HPP was first known in 1947, but it didn't really advance in science until about 1997, believe it or not. And that's when they discovered where the gene was, and they invented recombinant alkaline phosphatase. They know how to replace that. So Strensiq is a weekly, 3 times a week shot, or 6 days a week shot that you have to take. And it's an enzyme replacement therapy, which means I have to take it for the rest of my life. If I stop that, my bones will go back to being completely soft within 3 months, 4 months.
Wow.
And that meant when I started it, all I had to do was lean on my femur and it would crack, because I was aging at that time. I was 54. So they were getting more fragile as I aged. If you have it, and the reason you need to look at your alkaline phosphatase, if somebody diagnoses you with osteoporosis.
Oh,
Osteoporosis, it's contradicting if you go on a bisphosphonate, because slowing down the remodeling will actually bring on fractures faster for us if you're not on treatment of the enzyme replacement. So we have had a lot of people that all of a sudden get atypical femur fractures. They're on bisophosphonates, Reclass and Fosamax, and all of a sudden they're breaking and they're hurting more. And then they get worked up and it's like, you you have hypophosphatasia and we were wrong. You don't have it. The DEXA scans might show us low, or even a DEXA scan can read our bones wrong. In my case, I'm only a -2, but yet I was so fragile at the time.
well, and this is actually a known thing. And I talk about it a lot. People can have normal bone density and have very fragile bones.
Mm-hmm.
So,
I always relate it to an egg. You can put an
Yeah.
egg in there and it'll look good, but we all know how soft a royal egg is,
Yeah.
Get it right. High weekly intakes of vitamin D is also, even on enzyme, we can only go up to 1,000. Otherwise, all of us start getting a headache and we actually wake up more stiff. It's still not quite known about that. Daily intake of calcium. If you're on the enzyme replacement, you can up it until you don't feel well. You still can't have a full dose of it, but for the ones with one mutation, it helps them a lot to take calcium, unlike me. And then you want to stay away from high impact physical therapy,
which,
yoga and all those are great. Stretching, light weights help. So.
Okay, so let me go through this one quickly, because there's going to be questions. We're getting a little low on time because I started getting yakking about things. Okay, so there's a lot of misdiagnoses. Can be rickets, which
if you're younger,
if you're younger, or adult rickets, we call it too. Vitamin D deficiency, osteoporosis, fatigue. So all these things can result in osteoporosis, but they're not ruling out necessarily, they're not often ruling out hypophosphatasia. And in my group, we talk about this a lot, because most doctors are simply like ignoring the alkaline phosphatase, which is staring them in the face on that lab test, which is a very common lab test, and missing it. Misdiagnosis can worsen the prognosis by way of 2 factors: delayed and contraindicated treatment, many drugs that, okay. So So I'm going to leave the slides now, but one of the things I just want to bring up here is the anabolic medications. And I'm going to do a little research because I'm curious because the newest anabolic is Avinity, romosumab, and it works differently than the other two. And I'm sure somebody has opinions.
They're getting good. They're just they're asking them for the one gene people if they want to try. I'm probably not going to say it right. Timlosin. Timlos, and or go on Strensiq because Strensiq is very expensive. And they tried it Timlos, and they're actually doing well on it, and they are making bone. So, and it's not causing fractures so far.
Well, and the reason Timlos and Forteo, but I wouldn't go with Forteo either. I'd go with Timlos. I'm curious about Avinity in these cases because Timlos is going to improve bone quality as well as bone density. Forteo does that, and so all three of those do it, but from different mechanisms. Well, Timlos is a cousin of Forteo, so they kind of do it similarly. But Timlos impacts the extremities more than Forteo does. Well, they both do actually. They reduce fractures significantly, but they improve bone quality. So it'd be interesting to see what we call a trabecular bone score on people like you.
It is so hard to get that done.
Yeah, I know. It's hard for everybody.
For us, yeah. Forteo never, it is a 50-50 shot. They know that. Sometimes it makes people with one gene hurt more and they don't stick to the regimen.
Okay.
But Timlos is a little bit better. And there's a new, is it called anti-sclerotin? Is that the
anti-sclerostin? That's Avinity. But the other thing,
and that's what they're trying to get a study on.
Let me just say this to you. It's in my opinion that nobody should ever start Timlos or any of these drugs full force. Timlos you can dial. You don't have, and people who a lot of times have a lot of symptoms are because they're starting a 130-pound person on a 300-pound dose. You can do it slowly. There is no clinical reason not to do that. So I'm just throwing that out so you know for your community. Okay, so Christine Quigley wants to know, how is the bones, I guess you're saying bone-specific alkaline phosphatase different than the ALP, and what should the BAP level be? So what is the, there's a when we talk about bone turnover markers, there's the bone-specific alkaline phosphatase, the C-telepeptide, N-telepeptide. What do you know about those?
The BMP, they do run before you go on treatment, and it's always lower.
Then it should
definitely shows low. I don't know what the normal score is. It does, for that.
It's usually, I think the high is like 22 or something like that. But
I can give you my, I'm sorry.
Yeah.
I can give you my example. My ALP was 5 on the tests when I started.
The
bone specific was 0.3.
Okay, that's non-existent. Yeah,
almost non-existent. Yeah, it freaked out the lab, and my doctor called at 2 a.m. when they were running it, freaking it out. But that's the difference between getting it on a comprehensive metabolic panel. It may be a little bit higher.
Well, you want to do both. I mean,
you want to do both.
The big thing here is the alkaline phosphatase. And secondarily, I'm always curious to look at the bone. I order about 5 bone markers on everybody. But that's because I like to look at things in a little more detail. So, okay, everybody, if you got other questions, you can pop them over in the chat. I think one of my questions, because I know on a personal level how difficult your life has been. The fractures you've had, I mean, how do you deal with it? I mean, how do you manage? And
I guess it was easier being born with it. I don't know the difference. So something was always broken on me. I was in always 3 stages. One ready to break somewhere, one fractured and healing, and the other one was, okay, it's 2 years and it's still partly not healed in me. So the bone, I was lucky. I went to, in the 60s, you couldn't go to regular school. You had to go to a physically disabled, and they had biofeedback back then. And they really taught me how to handle the pain and push it away, that it's okay to have it and accept it, but you got to keep moving on because you don't know what you're going to feel like tomorrow. It could be worse. So that's basically that. And my family was, my mom said, they told me to treat you like any of the other kids. So I am treating you, even if I was in a cast, spike a cast from my chest to my toe, she would put me on the floor and say, your job this week is to dust the baseboard while they vacuum and, the chores around the house. So I was always treated the same, and it wasn't made like it was something horrible to have a fracture. I think that helped me psychologically growing up. I don't know how I don't have, PSTD and stuff like that. I do look at a slippery floor, like walking into Walmart, and I will freeze for a minute thinking it's ice, growing up in Chicago. And then I'll go, no, I can walk on this floor. I'm not going to slip.
Wow.
But, dealing with the pain, yeah, it was hard. I'm not going to say I smiled through it all. As my mother would say, I would whip dolls at her from my hospital bed at times because of the pain, she's like, you get to be a good ducking person when you're around her. But, I knew nothing could change.
Well, truly you're an inspiration. I don't know, I'd be the energetic, the way you're putting this out is remarkable to me. And I think that one of the things that I do try to say to people, because there's so much fear that people have around osteoporosis and getting a fracture, that it is part of life. Mm-hmm. And we can even do the medications, and it doesn't mean we're not going to get a fracture, but the fear of getting a fracture is worse than having one. I mean, then they can be debilitating. I mean, I've been through them. With my partner had a horrendous fracture last year, but living, say, fearing it for 20 years or whatever it is, the fear really can be debilitating as well.
My mom always said, try whatever you want to try, but if you're trying it, I don't want to hear you complaining that you fractured, because you might fracture. Not that she didn't want me to cry and all that. I'm talking through life and in college. So I never feared trying, knowing that, yeah, it may put me in the hospital for 3 months. There's no doubt about it, in rehab. But I like rock climbing. I like collecting rocks. So if I had to scoot up the mountain backwards, that's what I did. I didn't really fear the fracture itself. I feared the inconvenience in the family that would have to, give me, wash my hair, because you can't get into a shower with a cast on very easily, and stuff like that. That was more of a worry to me than actual fracture, because I always thought, the orthopedics can always screw me back together. I can, I've got so many screws and rods in me holding me together. And so maybe it's psychologically warped. I don't know, but
No, it sounds like you're psychologically evolved. And I think, whatever you've done, I mean, those of you who are over on chat, I want you to just respond. How are you experiencing this? Because my mind's a little blown right now.
Well,
truly.
What it feels like to be normal, though.
I don't want to.
When you get a fracture, it's scary.
Yeah, no, I don't want to minimize the teaching ability that you're offering. And I want you to hear that too, because I think you're remarkable. And a lot of people in your situation would not be where you are today with the consciousness that you have. And I think people won't start noting that. And Cheryl says, what an incredible woman. Love your attitude toward life. Take it in, because seriously, it's like you're helping a lot of people right now. Because people in my group and in my other group, that's 7,500 people, they're so fearful of these fractures. Some of them have never had them. That their life becomes, they stop their life.
Oh, don't do that. Then it wins. Never let it win. You have disease, you have osteoporosis, but you don't let it control you. That's just something you mentally got to fight for, that you're still in control. You don't let it rule what you do. Yes, you're not going to go rock climbing, let's say, but there's no reason why you can't walk on a gravel trail, and just be careful about it.
Be mindful.
If you break, be mindful. And if you break, times have changed that they can fix your fractures now, guys. And you're up in 3 days. They're getting you up and walking. It's not like when I was 5 years old, I fractured. I was in traction for 3 months, then another 3 months in a strict body cast that you could not sit up with. My mom had a tilt board so I could get the blood flow, and I'd have to stand in it until my legs swelled in the cast too much, and then we'd lay back down. And then it was another 6 months of rehab to get the leg working again, because with HPP, you totally lose all your muscles and you have to rebuild them from scratch. So, you know what? I'm a great quilter. I crochet. When I'm down with a fracture, then I bring out my crafting stuff and do that kind of thing. Like my grandmother would say, idle hands, don't let them happen.
Okay.
That's why I keep talking with my hands. Idle hands.
So Frank says, inspired by your attitude.
Thank you.
Katie says, Sue's right. Life is for living. Thanks for your inspiring bravery, Sue, Christine says. What a role model, resilience at its best. Sue is remarkable and a wonderful teacher. Janet says, amazing perspective on your situation. Thanks for sharing your wisdom and positive enthusiasm for life. Barbara says, so positive. Thank you, Sue. Lorraine says, Sue, thank you for sharing your wisdom. Laura Lee, you're an inspiration. Donna, amazing uplifting attitude. And Elle, thank you for telling us your personal experience to help us cope with this disease and our feelings. And I thank you too. I think, I kind of welled up myself just thinking about this, because I know when I was diagnosed how fearful I was. I've yet to fracture. I'm very fortunate, but I feared it because I'd never had it before, and they make us.
I accept that. It's harder to not be born with it, and what you've been able to do, and then somebody tells you, uh-oh, you did that, you're going to end up in the hospital. That can be very mind-blowing until you get around it and realize, you know what, I probably had this, what you have, osteoporosis, 2 or 3 years before they even knew I had it. So you got to kind of live like that.
Well, and the other thing is that what I say is people need to understand what they're up against. So if they have a very high fracture risk and they want to go skiing, and they need to understand that doing that may result in a pretty serious fracture. Some knowing that may start hiking or doing other things. I just say what we have to do is see what risks we're willing to live with. I did stop riding a bike. At this point in the city, it's just not worth it for me anymore. I'd rather be hiking, playing pickleball, doing other things that are closer to the ground.
Oh, right.
But we all make choices. And one of my patients who was a skier in the backcountry, she said, well, Lonnie, and she'd already fractured a couple of times. She said, I'll make a deal with you. I won't go where helicopters can't get me. So
there you go. That's what I always think. If one can't find me, I'm not going to be there. And all my cousins had to take first aid class. I have to say, I have a lot of cousins that would go out in the wilderness with me because I love the wilderness. And they all had to learn how to splint. It helped them being Boy Scouts and Girl Scouts and get their merit badges. But yeah.
Wow. Well, I'm going to make this public because I think everybody needs to hear you.
Don't fear your disease. I don't care what it is. Don't fear it. It can't rule you. Even if you think it's knocking you down and you only get 1 step forward and 2 steps back with it, you still have to take that step forward and keep living. Otherwise, you're just existing, and that's not what you're here for. So you're going to make a difference to your family and everybody else if you try.
Sue, I want to thank you so much.
Thank you.
And Corey says you're awesome. I agree with that. And I'm sure we'll be talking again soon. Thank you so much.
Anything. Thank you.